Okay. To do that, but it would have been valuable to have us talking now.
Can somebody
Is it-
tell me how I log on to the meeting, to the summit? I can't seem to figure it out.
I have it in an email that I sent you.
Right. I'll
Or
try
that
it again.
Steffi sent.
It's very straightforward. You just type in your name and email and you're in.
Okay, in Google, right? Or our
Are you
Google
talking about the conference or are you talking about Google Groups?
The conference.
the conference.
Yeah, just go to the link and
Oh, okay. And then the Google Groups, how do I get into that?
you should have received an invitation from Shelley and we can talk about that maybe after email.
Okay. Okay, great. Thank you.
I'll send
It was-
another invite. Maybe that would be helpful.
Thank you. That'd be great. So we'll just leave it at that. Thank you.
All right, well, let's go ahead and start tonight. Pretty excited to have you share, ladies. And you know what the format of tonight is going to be. Oh, okay. We're going to do everyone's going to speak for about 10 minutes each, or up to, doesn't have to be, about what they've done in their medication journey. I want to thank, for starters, Rika, Barbara. Oh, you know what? Diane, is Diane here yet? Diane is talking tonight too. Diane, are you? And welcome everybody. I see Lisa's here. Hi, Lisa, and yay, and Amy. Hi, Amy. And there's Diane. Okay, hi, Diane. Let me bring you up to the spotlight here. Get myself out of the spotlight. Let me see. There we go. Hello, Susan is here. Karen, hi, Karen. Trish is here. And those are everybody that I can see on my Zoom here. Okay, Sharon, of course. Okay, so for starters, we're going to start with Tish, and I'm going to ask you to take it away, Tish. Tell us a little bit about your story, if you would.
Shelley, where did you go? You're not on the screen.
I know, I put myself out so that you'd be bigger. Yeah, I'm just here, but just don't worry about it.
Yeah, thanks so much, Shelley, for asking me. I have a short medication story, but a long osteoporosis diagnosis story. So I was diagnosed in 2010 and came to this group last year when it started. So in 2010, my bone density was minus 2.5 at my hip and minus 2.3 in my spine. And in 2020, a year and a half ago, my bone density is now minus 3.8 in my spine, with minus 4, minus 4.1, and minus 4.2 scores in there. And my hip is minus 3.1. So I started taking medication October 2020. I went to my endocrinologist. I've been to several and really struggled with deciding to take medication, which is why I didn't take it for 10 years. And just exercising, diet, you know, I don't drink, I don't smoke, I don't eat sugar, I blah, blah, blah. You know, I'm really, really healthy, but I got this osteoporosis anyway. And exercising, calcium, vitamins, minerals, everything didn't seem to change anything. So yeah, in 2020, October, I talked to my endocrinologist after many hours and days deciding, and finally decided. So I took so he suggested as a first choice of medication, first time going on medication for osteo, he recommended Actonel or Fosamax. So I took Actonel. I took 5 doses and once a week, and got severe hip pain in my left hip, and really stiff if I sat down and got up. And I never thought much of it. I thought it was maybe arthritis setting in or something. But anyway, I talked to my doctor, he took me off. And so now I'm on Fosamax since June. And my mom was on Fosamax for 5 years, many years ago. So it worked for her. So I just, I've read so many things about all medications, and there's just so much confusion for me. I just went with what he suggested. And so I got I got some blood work done in December. So it was called ALP bone specific blood test, and C-telepeptides. These are bone markers that tell if Fosamax is working or not. So it's working really, really well. He said it's excellent. So I've asked him to monitor it closely, because I know someone else here that comes to this meeting, it didn't work after 3 years. So I want to monitor it. So in October, I'll get my bone density done again and a blood test, these blood tests, and then every 6 months, he's going to give me blood work and or bone mineral density. And I wanted to mention FRAX. So when I was diagnosed in 2010, I was 51, and I was devastated. My doctor just did it because I was 50, no other reason, even though my mom has osteo. So she never told me about FRAX. My physiotherapist, who developed my my workout program for a number of years, told me about FRAX, and that really, really decreased my stress, because my percentage of hip fracture was 1%, and the percentage of major osteoporotic fracture was 5.4%. And of course, that's gone up now, but still it's at 12% and 3.5%. So it's still really good. And I take Celexa. I have been on Celexa for about 25 years. And so I always thought that that had something to do with it. And there's some literature out there that says that it could be, but my endocrinologist says, no, it has nothing to do with it. So, we don't know who to believe. And I sent an email today, Dr. Lanny Simpson that spoke yesterday gave a website to find out locations of where they do the trabecular bone score or something. So I just sent an email today. I'm in Canada, so it's probably not in Canada, but I sent it anyway. And I put the link in the Osteoporosis group, our Google group. So, so those are my results and my side effects. And yeah, I'm really glad I went on medication on this Fosamax for sure, or Actonel. Fosamax is working, even though when I looked at the side effects over the past 10 years in the literature, I didn't want any of the side effects, not just the really serious one about your jaw and your esophagus, whatever. I didn't want any of them. Like, they're just like horrible. And so I'm not having any side effects. So I'm just so happy that it's doing really well. And I have the scores of the tests that I told you if anybody's interested. So yeah, that's all I want to say.
That's great. That's great. Wonderful. Thank you. Thank you. Thank you. That was great, Tish. I think we'll wait for questions till I think we'll divide up into drugs and then ask questions. So I think we'll move right on at this point to Rika. Thank you for your help with that, Tish, and I'll bring you back in a minute. Rika?
Yes. So I was diagnosed with osteoporosis in January of 2020, but my history really goes back to 2013. And that's because I had a fragility fracture, although at the time I didn't know that that's what it was. I was on a lawn and I sort of stepped backwards and there was something behind me. and I tripped and I had a soft fall onto grass and I fractured my wrist. And so I was seen in the ER for that. And then I was referred to an orthopedic hand and wrist specialist surgeon, and he put in a plate to stabilize that. And my internist did run a DEXA scan on me, and it showed that I had osteopenia in my spine and my femoral neck, not in my total hip. But there was no conversation about osteoporosis or follow-up or anything else at that time. And frankly, osteoporosis was just really not on my radar. So that was 2013. In 2020, my doctor decided I should have another DEXA scan. I've since learned that, should have been followed up much more closely than that. Because there are some who would classify, if you've had a fragility fracture and you have osteopenia, that you should be referred for osteoporosis right away, but I wasn't. So 7 years later, I had the next DEXA scan, and that did show osteoporosis in my femoral neck, and then osteopenia in my total hip and spine. So in February of 2020, I had my first meeting with my endocrinologist. And for those of you who don't know, I'm at UCLA. I'm actually in Los Angeles. So I saw my endocrinologist at UCLA. And at that time, we discussed a variety of options about where to go. But he said to me, you have, quote, severe osteoporosis because of the fragility fracture and the score. And so he recommended Tymlos to me. I left his office and said, I need to think about this. I wasn't concerned about doing the shots. That wasn't it. It was just some of the other things that I was more concerned about getting involved with. So that was February of 2020. And I think you all know what happened in March of 2020. We had COVID. As a result, I had decided at that point that I wanted to start on Tymlos, but I was not willing to go into a doctor's office unless I had to. And I was also, I was reading online, and I was fairly afraid of some of the side effects of that. And I needed time to think about whether or not to go on that. So it was really almost 8 months later when I started on Tymlos. That was in November of 2020. And I was lucky because I contacted Radius, the company that manufactures Tymlos, and they have a pretty good support system there. And so they send out a nurse to teach you how to do the injection. As it turned out, the person who came out to teach me was a pharmacist, but nonetheless, they have a staff of people who will come out and do that for you. And then he followed up with me, and at the end of that first week and regularly. And I had a question, and I called him, and so that was very helpful. And they also give you, it's probably the same thing with Forteo, but they give you a little grid of where you can do your injections each day. You can set it up any way you want in your abdomen. That's the main place people give injections, although I think they do it in their thighs as well. But they make it pretty. They sent me a travel kit and the whole thing. So, and cost, fortunately for me, was not an issue because of my Medicare and my supplemental insurance. So I paid $30 a month for Tymlos, which is, I feel very lucky as far as that goes. I've had mild reactions to the Tymlos. Of course, I was afraid. I did have a rapid heartbeat every day for probably the first few months. But it wasn't a scary thing. I was concerned it was going to be really something else, but it was not. And that's continued on and off throughout. I've now been on for 15 months. I also get a reaction where I do my injection. Most days I get for about 10 or 15 minutes some significant itching and redness, and then that goes away as well. Traveling with it can be, Forteo and Tymlos are different, but Tymlos does not have to be refrigerated once you start it, but it stays in the refrigerator until you start it. And so we took our first and only trip during COVID just this last November, and we went on a driving trip. And so I needed to take one of the injectable pens with me to start up when we were about a week away. And so I had to refrigerate that. And so we had a cooler in our car and the whole thing. And but that was the only difficulty with it. In terms of results, I have not had a DEXA scan. We're going to do a DEXA scan after 18 months. We had talked about me staying on for 18 months. But in December, I had a meeting with my endocrinologist because I saw my 18 months were going to be coming up in a couple months. And I wanted to talk with him about where we would go from here. And we had a discussion about the different options, which are, for me, Reclass, Prolia, Fosamax, the entire Evenity as well. One of the things that we decided was, or one of the things that he showed me, he brought up a study that was done by, and I have it here, but the doctors at, I guess, Mass General, Dr. Leader and Dr. Tsai, Dr. Yulin, who looked at, in this case, Forteo, but Tymlos is considered to be pretty similar. Tymlos or Forteo followed by Prolia. And in that study, they looked at when you would get, when someone on just on Forteo would get maximum increase in their femoral neck, and that was in the last 18 to 24 months. And so that seemed pretty important to me, that I would get the most bang for being on Tymlos in those last, potentially, I mean, I don't know, in those last 6 months. So we decided to keep me on for 24 months, and then I'll have to consider where to go from there. I'm considering Prolia, but I'm not sure about that at all. And I can provide a link to that study because it's really important, because it talks about how significant the, I think, as we all know, how significant the sequencing of medications is. And that Prolia, prior to Forteo, did not have good results. There continued to be some progressive or even transient bone loss, whereas Forteo followed by Prolia, the bone mass or the bone building continued even past the end of the Forteo, and there was an increasing bone density. I have also been on bone turnover markers, and when I started, we saw some increase in the osteoblasts and the P1NP, and we saw some decrease in the CTX, I think that's what it is, and it's continued to decline. So I don't know what my results are going to be, but I've been happy to be on Tymlos, having had almost no reaction, and in having the bone building that goes with it. So I'm keeping my fingers crossed.
Wonderful. That's great. That's terrific. Yeah, I think when you post that link, may I ask, will you also post it in Google Groups, please?
Yeah, I'll put it in
Okay.
Google Groups. Yeah.
Okay, fabulous. Thank you. That's great. Okay. Anything else you wanted to say, or should I move on?
Nope.
Okay, we'll come back to you. So
Okay.
don't think you're done. Okay. Okay, so for our next person speaking, I thought I would have Jane go ahead and talk, because Jane has also taken Tymlos. So, thank you, Jane.
My journey has been very similar to Rika's. In 2014, in January, I had osteopenia, and the ball was totally dropped. And until 2019, when I had a minor trochanteric fracture, just minimally displaced. And I said to my doctor, shouldn't I have had another DEXA by now? And he said, well, you exercise so much and blah, blah, blah. And I didn't really think you needed it yet. And I said, oh, those are very flimsy excuses. And I changed doctors after that. But at any rate, when I had the other DEXA, sure enough, my osteoporosis was somewhat advanced. I had a 31.7% risk for a major osteoporosis fracture and an 11.8 for a hip fracture. So, at that point in time, he suggested a rheumatologist, but when I did some research, I generally go to Mass General for most things because I'm up in southern New Hampshire, but the doctors up here, I don't think are the same level of care as the doctors in Boston. And I had a liver transplant at Mass General, so I generally go there for most things. So I did some research and chose a doctor there. And I had to wait for a while to get an appointment with her. And at that point in time, I thought maybe I would try going natural for a while, but the fall, and then the pandemic started, so everything got put off. And a little over a year later, when I had another DEXA, things had really dropped further. So going natural and doing exercise, diet and everything hadn't helped me one bit. It actually, things got a lot worse. So then in March of 2021, I finally ended up on Timlos. And I haven't had any problems. Initially, I take it at night before I go to bed. And initially, it seemed like I was maybe a little bit lightheaded in the morning afterwards. But that was it. And I've never had a rapid heartbeat unless you consider high 70s, low 80s to be a rapid heartbeat. So which is a little bit higher than my resting rate, but not so much that it would bother me or anything. So I've had no problems with it that I'm aware of. Some people have commented on a Facebook group I'm in, leg pains. Now I do have some leg pains. I had been assuming they were from exercise, but perhaps the Timlos is contributing to them. I don't know. But that's the only negative I've seen, that might be attributed to Timlos. So I've been happy on it, except for the expense. I know that the first of the year I was paying, when I started it, I was paying like $562 a month. And then when I hit the donut hole, it dropped down to, I think, about $180 or something like that. And I've heard rumors that the price has gone up. And for those of us on Medicare, it might be around $900 for the months until we hit the donut hole. So I'm sort of dreading, I need a refill now, and I'm sort of dreading ordering it because $900 is a lot of money, but if you're on Medicare, the only way you can get assistance is if your income is under $60,000 a year. So, with that, I thought it was 60,000. Somebody told me it was actually 50,000. So, we're not quite there. And so there's no assistance available. So, but overall, I've been happy being on Timlos. I actually was the one that suggested it I went to see two different doctors to get two different opinions, because I think it's a pretty important decision. And they both had, they would have suggested reclass, but when I said Timlos, they jumped right on that bandwagon. And I think that a lot of times with Timlos, I think that you have to have been on another medication first, unless you've had a fracture, which of course I had. So, I was able to get on it, and, that's worked out well. I haven't regretted it at all, other than the cost. I guess Forteo was almost twice the price of Timlos. So that was an easy decision between which one to take. But I've been happy with it, and I just have to decide. I've been on it for, I'm in my 11th month. And so I have to, next year, I'll have to start thinking about what I'll go on after. The doctor has mentioned reclass. I have a little bit apprehensive about that because of it, being in your system for a year. And I haven't decided what I'll do yet, but I'll have to decide in about another year. So overall, though, I've been happy with it, and it's, you know, I also, because I'm post liver transplant, I get lab work done every other month. They follow me very closely. And one of the tests, it's alkaline, what is it? Alkaline phosphatase apparently shows liver damage, but it also shows something with the bones. And when I went on Timlos, that number went way high, much, you know, it's still within range, but at the top end of the range. So my liver team immediately called me, all concerned. And I told them I'd just gotten in Timlos. So then they added another test that's more specific. And it was definitely bone growth that's causing that to be high. So that was reassuring that it is actually doing something.
Yeah.
And it's been staying, you know, I see that every other month. It's been staying up high, just below the top of the range. So,
It's great.
you know, I think that's means good things, probably. Hopefully it does. Hopefully when I'm off of this and when I get my DEXA, things will have improved significantly.
Absolutely. Oh, that's wonderful, Jane. Thank you. That is very helpful. Both, you know, guys are wonderful. We're going to come back to you too. In fact, I'm wondering if we should, if I should just remind everybody that if you have a question that you want to ask a specific person, that from what they've shared, that you write it down right now, because we're not going to do it the way we had thought. So we're going to ask people questions after. So please do that. Okay. Thank you, Jane. Wonderful job. And our next person to speak is Diane, and we're looking forward to it.
Hi, everybody.
Diane.
Can you hear me okay?
Great.
Okay. I have a heater blowing in the background, so I apologize for any background noise. So as some of you may know, I was diagnosed in 2018 at the age of 61 with severe, there's that word again, Rika, severe osteoporosis. I was absolutely shocked. You know, as a lifelong exerciser, somebody who watched my weight, no family history of osteoporosis, just completely shocked about this. Talk about left field. And I was told that it was pretty serious. And my MD gave me a book called Strong Women, Strong Bones, which I found, you know, it was, I don't know, seems like it was written in like, you know, 1972 or something, and said, why don't you go on Fosamax? And I was just like, it's such a daze. I just thought, how can this be? And, you know, the word serious. So I, unlike many of you who vetted this and, you know, were really very thoughtful about the medication, I just went on it because I was in such a blind panic about this. I saw myself in a wheelchair and not the kind of life that I would imagine for myself. So I went on the Fosamax. I never had any problems with it. I took it completely as directed, very, you know, religious about it, never missed a dose ever, and proceeded to ramp up my exercise and look into what not to eat, what to eat, all that kind of stuff. And so a year in at my first DEXA, I made some pretty good progress. I went from negative 3.6 in the spine, which is the main place, the only place that my osteoporosis is, to 3.2, negative 3.2. So 4 percentage points. So that was pretty good. And I, you know, kept doing what I was doing and try to fire on all cylinders. And so 2 years later, I confidently walked into my DEXA scan and my meeting with my endocrinologist at the Brigham and Women's Hospital in Boston. And I was shocked to find out that I was expecting even more progress, shocked to find out that not only did I not make progress, but I actually backtracked. I'm the person that Tish referenced before, I think, that my DEXA scan showed it was a negative 3.4 from negative 3.2. And I was dumbfounded. And I had also lost 10 pounds this was for the first 6 or 7 months of COVID. I walked like a mad woman just to save my psyche. And I'd slipped to negative 3.4. So the doctor then put me on Forteo. And so I've been on Forteo now for 15 months. And it is ridiculously expensive, but I'm very lucky with my insurance. I only pay $30 per month. So I consider myself very fortunate there. So at 12 months, my DEXA scan had improved from negative 3.4 in the spine to negative 3.0. The doctor was very pleased with that. I'm going to continue on this for another year until next September. I've also switched to Dr. Mark Wine that we heard from several months ago. I just loved his manner, and I love the fact that his mom has osteoporosis, and it's a personal thing for him. And I just liked how he approached looking at not just the medicine, but the exercise and the diet and everything else. And I've had one consult with him, and I just feel at peace because I feel like he's on the top of his game. I also had my P1NP done, which I think is bone turnover. I should have consulted my notes before this tonight. And it showed that I really am gaining bone. And my number is quite high, which is good. So that indicates that that the Forteo is really working. And I want to give a special shout out to Rika for making sure that I read the article on the sequencing study, because having been on Forteo now for almost the 2 years, the next question is, what is next? And it looks like it's probably Prolia or reclassed. I also sent the study to Dr. Wine, who is familiar with this study, of course. And he said, that's what I'm thinking, but we're going to wait until September. You don't have to make any changes now, and we'll see. So I feel very fortunate, but I also feel, quite nervous because I don't know how fragile the bones that I have are. So I feel like I am still 4 years in, kind of walking on eggshells a little bit, thinking, oh, I shouldn't do this or I shouldn't do that. Or I'm very conscious when I'm lifting things, and I lift them from the center and all of that. But that's my story.
That's great. That was wonderful. Wonderful. Thank you very much. And it's so nice to see, some of you connecting outside of the group to get support from each other. And that's what I hope to achieve even more so with Google Groups. So anyway, I think that study will be helpful for all of us, Rika. Thank you for sharing that. Okay, so thanks, Diane. And we're going to move on to Barbara. If you can go ahead, Barb. Thank you so much.
Thank you. So I had my first bone density at age 50, and like many of you, I got the results and thought, how can this be? Because I was an avid exerciser, running, skiing, hiking, and all of that. So I was quite surprised. And I was referred to an endocrinologist, and he put me on Fosamax. I think he ruled out hormone therapy because I had a history of breast cancer in my family. So I wasn't going to go there at all. So I probably I was on Fosamax for 5 years, starting in my early 50s. And after that 5-year time, I guess that was the thought at that point, that you go on to something else after 5 years. And so he recommended Prolia. And I was on that for 2 years, 2 full years. And then my family moved from Western Massachusetts to the state of Maine. And so I had to start over, finding new doctors, or finding a doctor that had some knowledge of osteoporosis. And that took quite a while. And I don't know why it didn't occur to me to look for an endocrinologist, but I was just hoping to not travel far. And so I did find a primary care doctor that has a specialty in osteoporosis, and she looked at my chart and said that it looks like you probably will be on drugs for the rest of your life. So I think we should take a drug holiday for a while. So I've been on a drug holiday for 6.5 years, but last summer I started having some groin pain when I was running, and first of all, my doctor thought, well, let's send you to a physical therapist. And the physical therapist thought it was something with the sacroiliac joint. So I did therapy for that, but it wasn't getting better. And I also see a physical therapist for my osteoporosis. I see her twice a year. And she just worked with me on posture, what exercises are safe to do, what yoga poses to do, what yoga poses not to do. It's been very helpful. And she said, well, how are you? And I said, well, I'm having this pain. And the first thing she said was, you need to get an x-ray right away because you have your numbers. My osteoporosis in my spine is a -3.9, but in my hips, it's osteopenic. And so I got an x-ray, and actually the x-ray wasn't going to show enough. And so I argued to get an MRI, and the MRI showed that I had insufficiency microfractures in my pubic bone, which I went, whoa, because I've fallen a lot, like landing on my wrists and from just running on trails and whatever. I've never had a fracture at all, but this is what it showed. And so with that diagnosis, it was clear that I needed to go on something that would build bone at this point, and because I had been on holiday for so long. So then the question was it going to be Forteo or Tymlos? And I also, my physical therapist, my osteoporosis physical therapist is Canadian. So she put me on to a woman named Margaret Martin. I don't know if you've seen Margaret Martin and Melio Guide. And she had a series of interviews about medication. And she was interviewing an endocrinologist, I think in the Midwest, maybe from Nebraska or somewhere. And they had a discussion about Evenity, which, sort of, I perked up about that. And I was having a hard time wrapping my head around giving myself a shot every day. I really applaud you ladies that do this. I just thought, I can't do this. I didn't want to do it. And also the side effects I thought were very scary. And I got onto a Mayo Clinic has a Google page, or maybe some of you are on the Mayo Clinic website with their support groups. And I was just reading all these horror stories about side effects with these drugs. And I thought, oh, and of course you probably shouldn't read the internet. But it sounded very scary to me. And so I finally asked, after my third meeting with my doctor, I just said, what would you think about Evenity? And the other thing that happened is that my Medicare, I was on a Med Advantage plan, and they covered Tymlos, but I was going to go on that. And the next year they dropped it. So I would have had to start over again with another insurance company. And I know with Evenity, you have to go get that at an infusion center. So I know it would be covered under Part B of Medicare. So I wasn't worried about the cost. I like the fact that it's once a month. And you're on it. Right now, they just recommend being on it for 1 year total. And so my doctor had never a patient on it, really didn't know that much about it. And so I asked if she would look into it, contact her colleague or two. And so I think this was my third meeting with her, trying to figure out what drug to go on. And when I went that time, she said, I've talked to a colleague and his patients have no problem with it. What I'm reading in the Mayo Clinic website is that the people there that are on it don't have a problem. The big worries are stroke and heart attack. And I didn't think that, to me, I didn't think I was a candidate for that because I'm pretty healthy. I'm on no medications. And that seemed less scary to me than the rapid heartbeat that I read about with Tymlos and Forteo. So I had my first shot of Evenity January 3rd. I'll have my second in February. And because of the dosage of the shot, it comes in you'll get 2 shots. I get 1 in each arm. I think the next time I'll probably get them in my stomach. They alternate. And I was sore, sort of like that flu arm, for maybe a day or 2, but I've had no side effects. And I should also say I did not have any side effects when I was on Fosamax or Prolia. So I'm hopeful about it. And the big question is, what will I go on after Evenity? Evenity was approved by the FDA about the same time that Timlos was. So it's a relatively new drug, I think 2019. And that was one of the hesitancies of my doctor. She had most experience with Forteo. And I said, well, if you were me, what would you go on? And she said, Forteo. So I was going, oh, I said, what about Avidity? So I wasn't going to give up on that. So we'll just see. It's so new that I don't think people really know what would be the next drug in the sequence after this. So maybe one of our speakers coming to us in the next year will have that information.
Let's hope so.
Right.
I hope so. We're looking forward to learning more and more. So thank you. That was quite helpful, Barbara. Appreciate what you shared. It's great. Thank you. All right. And we're going to finish our 6 people first, and then we're going to go break out, and Trina's going to be our 6th person. And then we're going to break out into different medications for you to discuss. And the people that have been taking them, if you'd like to do it that way, that's what we were thinking of doing, is talking about Fosamax and talking about Timlos and etc. Or we could go ahead and ask people questions if you'd like to. Why don't we do that for a few minutes? Okay. Anyway, maybe, I don't know. We'll vote after Trina talks. Anyway, take it away, Trina. Thank you.
Hey, well, I made some notes because I've been on quite a few drugs. I'm kind of similar to Tish and Barbara in that I'm very active, and I was diagnosed at age 50 with a T score of minus 3.6 in my spine and nothing in my neck or hip. So at first I tried Fosamax orally, and I couldn't tolerate that, my stomach and esophagus. So I was on that for just about 2 months. About a year later, I started on Forteo because my scores were so bad. I had no side effects, and it increased my bone density by 15% over the course of 2 years. But I had a dental assistant who had told me, whatever you do, stay away from reclassed, the bisphosphonates, because of the problems you can get into with your teeth. And I do have pretty bad teeth, which I'll go into in just a second. And so I made an executive decision myself to go on hormone replacement therapy instead of going on some bisphosphonate, which is what the doctor wanted me to do. After you are on Forteo or Timlos, you need to follow it up to seal the deal, so to speak. And so I was on hormone replacement therapy for 3 years, and it did nothing for my osteoporosis. I lost all the gains from the Forteo and then some. So that was a big disappointment. I think at that point, I just said, well, I'm going to use exercise to get my way through this. And so I tried that, and I lost more bone density. Exercise, intense exercise, not necessarily the exercises that now we know are better, but it didn't help at all. And so finally in 2019, my old endocrinologist said, we have to do something, because at that point my scores, my spine, was down to minus 4.4. And so I still did not want to do reclassed. I'd done Forteo, so I went on Prolia, and I had terrible side effects from Prolia. I don't know, I guess other people here have taken it. But they lasted for about 6 weeks, but I had fatigue, weakness, lightheadedness, headache, bone aches, very, very dry skin. I had on my face and my body, like I just had patches of scaly skin, heels and finger splits. I had burst blood vessels in my skin on my face, some big ones, and very dry eyes. And it was difficult to exercise. My joints ached after exercise and everything felt inflamed. And I felt 10 or 15 years older than I was. And so I didn't go back for my next shot. I just couldn't tolerate it. So I took another little self-imposed holiday, and I guess not very long. And then I switched doctors to Dr. Lou at Brigham, and I had another bone density scan. It was now minus 4.5. So that wasn't that big a drop. So maybe the Prolia did something, I don't know. So I have had 1 injection of Reclass so far. I had no side effects. I have not had any bone marker tests. So I went on Reclass because I was given 2 choices, either Evenity or Reclass. And I explained my concerns about future healing, because at this point, even though Dr. Ween was talking about, prescribing Forteo and then going back on Forteo, at this point, insurance will only cover 1 treatment, 1 2-year period of Tymlos or Forteo. So the choices for me were Reclass or Evenity, and I was worried about, future like hip replacements or knee replacements and bone healing. And I don't exactly know why this was so important to me, but I guess I'd been reading in the literature that sometimes they use these drugs to, as Dr. Ween was talking about, to boost healing. Like if you've been on Reclass, which is especially with the teeth and the jaw necrosis, you can boost healing by using something like Evenity. So she suggested putting me on, I'm not being very clear, but anyway, she put me on Reclass. I had some friends who had been on it and they had not had any side effects. And so that was good. And my dentist said, I think it's okay. I think you have to do what's right for your bones. So I did have a dental procedure. I have a filling at the root of my tooth, and I had that redone before I went on Reclass, and now it's sore again. And the next step for that tooth is to have it removed. And so I'm a little very concerned about being on Reclass with the possible tooth removal. And so when I see my doctor in a couple of months, that will be my first question. And it could be a sinus issue, but why would I have it on only one side of my jaw? And I've heard that Reclass takes 3 years to clear your body, not 1 year, but I can't remember where I got that information. So I don't feel like I did it a very smart job. I think if I were to, so I was first diagnosed when I was 50 and I'm 65 now. If I were to do it over again, I certainly would have paid real attention to all of the lifestyle changes right away. Like I didn't take it that seriously when I was 50, and it took me quite a while to really wake up and go, okay, I'm gonna get on the bandwagon. Fractures, I am very active. I sound kind of like Barbara, and am in a position, I fall a lot hard, and I've never had any fractures that won't really at all. And then about 2 years ago, I had 2 traumatic fractures with enough force that they wouldn't probably be called osteoporotic. And then a year ago, I did have a avulsion fracture of my ankle, which was definitely due to osteoporosis. So it's catching up with me that way. And I think this is just a little bit off topic, but I still want to do the things that I do. But I think being mindful and not multitasking is critical, and hiking with poles, but not taking a picture while you're hiking, not just, you gotta watch every step with as much focus as the next one, and not fall on your ski pole tips, which gave me a broken rib. So that's my story. So I don't know what my future is. I'm just trying to take it one step at a time, I guess.
Well, aren't we all? And, we're all learning and growing this thing together. So, I think we all kind of beat ourselves up a little bit about it. I think if we took a poll right now, everybody would say that they wish they went on supplements and ate better and exercised more intentionally as well. So I hear you. I mean, I think especially you're so active, Trina, so active, and that's admirable all by itself. So
My mother did have osteoporosis, and I have extremely tiny wrists. So I think some of this is genetic and really can't be overcome,
yeah,
as we've been hearing people talk about.
yes, for sure. Well, I appreciate you sharing. Yeah. Maybe that should be our motto for empowered skinny wrists. We can do this. All right. Well, why don't we go ahead and I'm going to ask that question, which is, would you prefer to divide into the drugs and ask about the drugs now, and then we can address those people that took those drugs? Or would you prefer to at first ask the people? Anybody could unmute so they can share what they think.
I'd like to ask the people.
Okay, you'd rather ask the people. Okay, let's start with that then. Is anybody?
Well, that's just my opinion.
I agree. I agree. What do you think, Diane?
Well, I think given that for all of us, whether we like it or not, this is a lifelong thing. The next drug you might be interested is one thing, but we will have others down the road. So maybe we should just do this as a group for a learning.
Yes, I think so. I found this even more helpful than.
I would agree with that, Diane. I'd like to hear people's responses because I'd like to know about other drugs.
Yeah. Okay, thank you. Jane, did you want to say?
Tish, for some reason, when you were talking, it was sort of echoey for me. I have hearing aids, and sometimes, things don't come across as clearly. And I didn't catch, which medication are you on?
Fosamax.
Fosamax?
Yeah, I think it's the room that I'm in, Jane.
I'm sorry?
I think it's the room that I'm in. It's a bit echoey.
Yeah, it's a little echoey, so it's a little bit difficult for me to understand. I have a clarity problem.
And Tish, I have a question. This is Amy, and I'm just wondering, what tests were they doing? You said they're doing for bone marker tests. What were they doing for you? What did you get done for testing?
Yeah, I think Rika mentioned it, CRX.
I think Dr. Lindsay was talking about that too. I think it's CTX, maybe?
CTX.
And the other one is ALP specific.
I'm sorry, I missed that.
ALP bone specific.
Okay, thank you.
And another one that looks at the osteoblasts is the P1NP that shows the bone building. That's a fairly common, I think different doctors do different stuff. So.
Right. It seems like there's no real protocol, that different doctors just choose different things. Okay, I'm surprised that, I think it was Trina that was saying that she had some hormone therapy. But usually they only do that if it's really mild, like osteopenia or something, a real mild osteoporosis. And it just seems like everybody does something different. And I'm having a hard time trying to pick endocrinologist to start meds too, because I don't, it just seems like, I know that it varies depending on our lifestyle and our bones and a lot of different things, our insurance sometimes, but it's just still really, as far as protocol goes, it just seems very different depending on who you talk to. So do you like your physician? Any of you? Diane, I signed on with Dr. Wine, but he doesn't have anything till the end of May. So he only sees people every Wednesday, so afternoon. So
Yeah, I was very lucky. I emailed him as soon as we got off that presentation with him. And he was able to squeeze me in. It was very last minute and it was video. But I have an appointment with him in September. So be vigilant if that's who you want. I found him to be terrific.
Okay, thank you. I think
Does anybody want to address what Amy suggested? Amy sort of had a question there, which is, how did you come to what you, where you're at in terms of the choices you've made? Does anybody want to talk to that? Speak to that? Go ahead, Amy.
If you don't want to speak to that, who was the one that said that you get the most buildup after 18 months on, was it Timlos or Forteo, or would it be the same? Is the same for Timlos is the same for Forteo? Aren't they really basically the same? Hi, Rika.
Hi, I was the one who said that. I think Diane may be able to add to it. The study was done with Forteo, but my doctor who has me on Timlos was the one who showed me the study and said that, we can expect essentially the same thing from Timlos because they both have similar action.
Well, it's interesting because Dr. Lindsay was saying that after 17 or 18 months, did you remember that?
I did remember that. And different doctors have different things. And I mean, that's why we're all confused, I think, sometimes. But also, I have the study to look at, and it's one study. So there may be another study that shows something different, but this was done by these good docs at Mass General.
Hi, Diane. Did you want to say something?
Just a footnote on that, Amy. Dr. Wine said that there is still, like, the first 12 to 18 months is very good progress on with Forteo for the spine, and maybe less so in the subsequent year. But it helps the neck and other places, hip, more in those last few months, which I think is what Rika was saying. And he just decided that he would recommend keeping me on it. So since I'm doing well with it, I'm just going to stay on it for the 2 years.
Okay, then I'll throw this out. I don't want to monopolize the whole thing, so I'll just quickly throw out one more thing. I like Dr. Lindsay. I didn't like the sexist remark he said in the very beginning, but he did seem, I liked him. I thought overall, except for that remark, but now you're saying that, and I'm thinking, because I thought maybe I would see him instead, because I have to wait till almost June to see Dr. Wine, and then when I start meds and I'm already, severe. So, obviously I have to make that decision, but that makes me even more leery of seeing Dr. Lindsay. And I was a little bit worried because he has so many openings, like you can see him right away. So
I just want to speak to that a little bit. He is a researcher of the past. So a lot of, if you look up his, I can't think of the word.
Publications.
Studies, his publications, they were at least 10 years ago.
Okay.
So you might, I wanted him to come on as a grounding force, but it's Chris,
Okay.
it's up to you
Thank you.
too. I think he's good, but we're also having someone from his facility speak, who is doing some current research I think in June. So, and I can give you that name later or
Great.
now if I can read it. But go ahead.
Thank you.
Anybody else? Thank you, Amy. Are you?
I just want to thank everybody for spending so much time with us to do this. So thanks.
Amy, I
Mhm.
suppose just, I mean, out of curiosity, I suppose it depends on your insurance company, but and how much leeway you have. But you could easily consider just having a consultation with Dr. Lindsay. You don't have to take any action. You can just feel him out in an appointment and see what you think, and just absorb his input. I know, as some of us have shared along the way and today, I've actually gone to thinking there would be the one endocrinologist. I've seen several, I think I've made my pick, but honestly, I'm still not 100% sure. But I've seen more than one person, so it wouldn't be, unreasonable. And the other thing, you can also, with Dr. Ween, even though I'm not in the Boston area, but just as a concept, even though they all are months out in their appointments in general, get your appointment, then find out what their process is for getting onto a wait list for cancellations.
I did that. Yeah.
And that's another thing that, could come up. So.
Right. Thank you. Who is that talking? I can't see.
Oh, it's Lola.
Lola. Thank you. Yeah. I could, but the thing is, it's almost like you have to go, and then you have to look everything up to see if what they're saying seems like the right thing to do. I work as a healthcare professional, or I did. So I just I'm skeptical, in general, but yeah, I can see for everybody says here that you have to do your research and you have to really know what's going on the best that you can. So thank you. I have Blue Cross Blue Shield and Medicare. So I don't take a lot of things, but I think it's pretty good. It's been wonderful, actually. So
Amy, I just put it in the chat.
thank you.
She's going to be speaking to us in March. And she does research like Dr. Wine currently.
I have a question. This is Lorraine. Probably a silly question. From several of you commented, Barbara, I think, and Trina are very active and do some exercise a great deal, and have maybe had some not unrelated fractures. And I'm also looking for a new endocrinologist. I live in the Worcester area, but I'm willing to come down to Boston. But my department told me that my DEXA scan was only covered every 2 years. I'm now on Medicare with Blue Cross Medic's good plan. But many of you mentioned that you got a scan every year or every even 6 months. And how does that? Yes, Trina.
All you need to do, I also was told that by my insurance company. I'm on Medicare and have a supplemental, and the doctor just needs to write a note that it's medically necessary, and submit that to I think I can't remember exactly where they did it, but you could call your insurance company or call and see.
Okay, so they can do an override of that 2-year
Apparently,
restriction.
yeah. I mean,
Yeah.
I asked the doctor's office, well, does this always go through? And they said, oh yeah, not a problem. But
Right.
from the insurance, even I thought a very good supplemental plan, and they said, oh no, only every 2 years. So
Interesting.
They all say that. And then, of course, all of the drugs, several of you mentioned how expensive the Timlos and the Forteo were without the right, and I assume because those are not infused like Reclast is, which is covered under Part B, that those two are under the Part D, whatever your drug benefit, unless you have an HMO, in which it's wrapped into that. So do you know of any resources? I haven't decided which of these to take. I couldn't tolerate Fosamax. So Diane, you had raised your hand there.
Yeah, I just wanted to let people under 65 know that if you go on Forteo, it's manufactured by Eli Lilly. And when I first went on, I was under 65 and I ended up paying $3 a month for it. It was amazing. And then that stopped when you have, quote, government insurance. So if there's anybody considering Forteo under the age of 65, you can go to the Eli Lilly website and you don't even have to put anything financial in there. I thought, oh, I'm not going to qualify for this, but it's not even financial. All you seem to need to do is ask. So I just wanted folks to know that.
So I do know that I'm a healthcare provider, and I do know that so many drugs are covered by what they call commercial insurance. So, like if you're on a blood thinner, I deal with vascular. So we have to, Medicare, forget it, those coupons don't work and you're paying through the nose for those drugs. But then the people who have regular insurance before 65 get them almost for nothing. So I don't know if there is a resource that met people on Medicare and a good supplemental as to which drug plan might cover these, because you only have a certain time every year that you can change your drug plan and jump onto something. I know like things like Fosamax and Reclast are covered by everybody, but some of these other ones are so expensive. I don't know if there's any resources like that to guide you into. They were worthless at my clinic. I asked about that and they said, oh, we don't know, call your insurance company. And if anybody's tried insurances, you know how many there are out there for Part D. Yes, Rika.
I know that Radius, which produces Timlos, does have some support for patients. I don't know what the financial, threshold may be on that one. I
don't know if it was you. Someone mentioned that it was only if you made under 50 or 60,000 a year.
That was somebody else, but they also may be able to lead you to the right insurance company as well, because they're very interested in getting patients on their drugs. So
sure.
I just wanted to, go ahead, Trina.
To piggyback on this topic, Dr. Wine was talking about how in the future, we may be, or even now, wanting to treat with 2 drugs at once, or using Forteo multiple times. Well, theoretically, that's good, but I'm not sure that insurance is going to cover it at this point anyway. My doctor, Dr. Liu at Brigham and Women's in Boston, did say that, I think she said that they are considering allowing people to do 2 courses of Forteo and maybe Timlos too. And so that might be changing coming up, so that I would be a candidate for that. Although I know that it doesn't tend to work as well after you've been on Reclast. So it's like a suitcase that pops up, you can't close a suitcase.
Yeah. Interesting. Wow. I noticed that Marissa asked a question, if anyone can answer that in the chat. Is anyone currently taking Agisthus raloxifene?
I can address that a little bit. I'm not taking them. My sister is on raloxifene, which I believe is Zevista. Is Agisthus another brand name for that?
Who's that speaking? I just
Lorraine, I'm sorry.
Oh, okay. Okay. So she's taking that.
So Marissa, is the raloxifene branded Agisthus or Agisthus?
It's branded raloxifene. I also immediately contacted Dr. Wine after his talk. I met him in person. I have to say he's amazing. I really felt like I've gone through 3. He was my 3rd doctor, maybe 3 is a charm. One of them
I'm
I
getting
know,
on
so
the
I'll just give you a
list.
brief background. Everybody knows my story practically, but I am 55. I was diagnosed at 52 or 53, went on Fosamax, have done, like, couldn't tolerate it, and have been on just have taken nothing. I haven't even started raloxifene. I have fear of starting a medication. I don't know what's wrong with me. I can't seem to push the button on it. And I tend to read the side effects and say, no way in HELL am I doing this. And one doctor wanted to put me on reclass right away, and I didn't do it. And Dr. Wine said, for my age, that would have been a huge mistake. So I just don't know what to do. And then there was that doctor, you guys were present. I don't know if it was Dr. Lindsay or who it was, who said, if you were my patient, he was talking to me, he would put me on Forteo. It's like, I'm so confused that I wrote to Shelley and said, I can't do this group anymore because every time I come on it, I leave feeling worse than before I got on it. And not because of all of you, all of you are wonderful. It's that I can't take this cross messaging. I can't take it. It's making me crazy. You know, I can't sleep for nights after this because it's like everybody has a different, every doctor, not everybody, the medical, you know, physicians have a different take on everything. And I just can't figure out what to do.
That's what I was saying before, Marissa. It's like, I'm really scared too. And I'm probably in almost the same place as you, where I had a lot of sleeplessness about it. I'm just coming to, my back is so bad. I know if I get a fracture there, I can't risk that. So I'm kind of succumbing, but I know exactly what you're talking about. Maybe not your experience, but just, I know. I don't have any, I'm probably not the wrong person to respond to you, actually.
No, thank you for saying that. I appreciate it. I really
So
do.
I just want to jump in with respect to who do you talk to, who do you trust? And that's the most difficult thing. I was just diagnosed, and I went, to a couple of different places to get information, and I was getting all this conflicting information. And this is the first group that has been so helpful, and I'm so grateful to you, Rika and Barbara and Trina and Diane and Jane and Tish, to just talk about what you had to deal with and all the questions and confusion. This is the first place I feel like I'm talking to people who I trust. And it's a terrible place to be. I'm not a person who mistrusts doctors. It's just, there's just a lot of conflicting information, and I don't understand why. I mean, maybe because there need to be women doctors. I don't know.
Why don't you go ahead, Rika, and then Diane.
There was a note to me in the chat, and I wanted to clarify something because it was asked about, how come my rapid heartbeat for several months didn't scare me. And I guess I was so scared to start with about the rapid heartbeat and everything else that when it actually happened, and maybe, I should explain it better, it's soft. It's not like it's for me anyway, it's not like it's pounding like I was running hard or anything else. So it's a soft rapid heartbeat. And it almost, I won't say it became a comfort by any means, but I knew that the medication was working, or at least that I got it in properly and everything else in the beginning. So it certainly wasn't reassuring. I don't want that, but it wasn't nearly as scary as I thought it was going to be. So when the reality came, it was not scary to me because it was pretty soft. It was, and it got through very fast. That's all. I wanted to clarify that.
Good. Diane, did you want to follow up with that?
Yeah, Marissa, my heart goes out to you, and Sarah, your note as well. I have felt the same way. And it's been such a journey, but here's what I know that seems to be true when you start on this journey. It's going to be a journey for our lives. There'll be times we'll be on medicine. There'll be times when we will not be on medicine. And my view has always been, take the medicine, but do everything else, open up every other door to try to build your bones and to live without stress. We take in information, but maybe not too much, but enough to make an informed decision. And what I know, it seems to be true, is that Fosamax seems to be sort of the first line of defense. So your internist finds out you have, osteoporosis or whatever. Okay, Fosamax has been studied for a really long time. It's extremely cheap. It's practically generic now. That's what they seem to put everybody on. If you can't tolerate that, or if it doesn't work, then it leads you down another point in the decision tree. And for me, the decision to put me on Forteo was because I was in this serious category. I didn't have borderline osteopenia. I had full-on osteoporosis. And, relatively speaking, I can't even get the words out, young. I don't feel young, but I mostly feel young. But, for this, no. So Forteo's been around for 15 years. So like Rika, I was sort of going back and forth about the Tymlos versus the Forteo, which was what my doctor told me. And I chose the Forteo because it'd been studied longer. That's all. She said they were practically the same. So I still have my doctor at the Brigham, who's a female, and I'm switching over to Dr. Wine, who's a male. I usually prefer a female doctor, but in this case, I'm so grateful for hearing him, because I just felt his empathy and his kindness and his, I'm not going to bullshit you, and I'm not going to get you on this drug because I'm going to make money. It wasn't any of that. I just had this instinctive trust for him. So I followed my gut on that. But he also was corroborating the same things that Dr. Chow at the Brigham was saying to me, that at this point for me, it's Forteo, but then it's either reclassed or Prolia. And he's now saying, maybe between now and when we need to make the decision, there'll be something else, some other studies that will give us some more information. So, all I can say is find a doctor that you like, trust the process, and trust your gut. Listen to it, to the rest of our experiences too, and it will get better. Thanks.
Excellent. Thank you. That was great. I mean, I thought it was great. Marissa, do you feel more comforted?
I do. Yeah, thank you. I can't even tell you how much I appreciate that. Thank you so much. All of you who have written in the chat, and Diane, thank you for what you said. I know it's hard to trust the process, but I know you have to trust it. I don't know. I think we're all like just stunned when this happens to us, right? And I don't mean stunned for a month. I mean stunned for years. Just, how did this happen? How did I get here?
So I agree with what Diane was saying, that it is a process. I think a question that might be helpful to ask, because I think a lot of these doctors are kind of following the same protocol. They're taking all the information that you're giving them, and there may be some differences of opinion, but maybe if you ask, so what makes you suggest that drug? What about my profile makes you think that would be a good fit for me? And what other choices would you think would be could be considered? And the fear about going on a drug, I really get that. And it's just really hard. I think for those of us who do find ourselves anxious about this or other things, finding some sort of relaxation technique that you practice every day is really helpful, and can benefit you in beyond just this one issue, but throughout your lives as we're going through this pandemic. Beyond exercise even, I'm talking about something a little bit more structured than that.
It's really true. I just want to echo that. That was going to be a comment I was going to make myself, because about maybe 5 years ago now, I started meditating. I was traveling an awful lot for my job, and it was very stressful. Oddly enough, I didn't know to worry about osteoporosis, even though I had a diagnosis. I was kind of putting my head in the sand about it. And I just want to say that cortisol, as we heard from Dr. Dawson and the nutritionist discussed that too, is produced more, and it's counterproductive to being a good steward of your osteoporosis. And that really is a major concern, is to make sure that you can calm yourself down. I know, and be able to sleep better and all those things, be more present and be happier. Those are all good goals. Anyway, but I have to say those were great. Thank you for being so open, all of you, and Marissa too, just that this is the best place to share your concerns. So any other questions for these wonderful people?
I have a question about the Timlos of the Forteo. Either one of you, this is a very naive question. Why do you follow up? Is it to maintain your bones or to improve? Because if you didn't do it, would you just revert back to baseline?
Yeah,
Okay.
that's what happened to me. I didn't follow up with a bone. I forget is it a bone resorptive, or I did not follow up, and I lost all the gain.
Sorry, that's too bad, Trina.
Yeah. But I also was young, and did I want to start reclass then?
No, I get it totally. I mean, I've had my head in the sand. I'm severe now, so yeah.
Just a comment about that follow-up. It's been very confusing to me about these, the Timlos and the Forteo and some of these other anabolics, or whatever class they are. You have to follow them with a biphosphonate or something like this.
Right.
And if the reason you're going to those is because you couldn't tolerate the biphosphonates because of the side effects, it's like why are you using those then anyway? Because
well, the Fosamax is a oral, and so it affects your esophagus and your stomach, but the reclass doesn't do that. Most people have just a little bit of a fluey sense. That's an infusion. It takes about 10 minutes.
Right, and that's just an acute phase reaction. But some people, and I happen to be in that 10%, have horrible, it inflames your osteoarthritis. I have a hip replacement, I have osteo. And so I couldn't even raise my arms over my head. It was awful. And so I thought, how can I do Forteo? And then I am stuck taking one of these other biphosphonates. So again,
it's
how do you balance these? It's
I was just going to say, with Prolia too, you must follow up.
Yes, right, exactly.
After,
yeah.
So.
I just wanted to comment, I know we're going backtrack, but Marissa, your original question was about raloxifene. I did Google that first word, which didn't come up as a medication, it came up as a Greek god, but the raloxifene I do know about. And someone else here mentioned that you might always ask the prescriber, what's the specific indication for that drug for my case? And I know that you were concerned, or your provider was concerned about your young age, and therefore not wanting to go on some of these more drugs that might cause osteonecrosis and some of these other things at a young age. But raloxifene, I do know, is it's an inhibitor for breast cancer, and it's used in women who have high risk for breast cancer as a preventative means. It's also used as an alternative hormone replacement therapy, and the main risk of that drug is blood clots. My sister takes it. I've prescribed it before for postmenopausal women at high risk for breast cancer, but I do know for osteoporosis, it is not indicated for that. It's indicated for osteopenia, but it only affects the spine. It doesn't affect the hip buildup and such. So I would go back, like someone mentioned, and ask your provider what specifically about that medication is going to help me, because I recall you said
you just hit on it.
you had
Yeah,
more
I think
severe.
it's my spine. That's where I have it, in my lumbar spine. That's the only
Okay.
place I have it. Maybe that's why, right? Yeah.
Maybe so. Although, again, it was for osteopenia specifically, not if you've gotten to the higher degree of osteoporosis, I thought you said. So
Okay, thank you for telling me that.
yeah,
Yeah,
just something I would
thanks.
ask about.
Well, I haven't started it yet. So, but I want to add, just while I'm off my muted button, I appreciate everyone's comment on how, you know, everyone wanted to try and, I don't know, combat this with exercise and diet. And really, you know, you can go on the internet and it leads you in some places to believe that, hey, that might work, but it doesn't work, right? It's not going to work. Yeah. It's going to help, but it's not going to work to totally combat it. You have to have a medication.
I agree. I've done reading clinical practice guidelines, which are terrible for this disease, unfortunately. But they're not as good as some practice guidelines that you can get a good answer, right? But it was described to me that osteoporosis is a hormonal disease. It's not a disease based on lack of exercise or calcium in your diet. Yes, those help, but it's actually a hormonal disease that needs to be treated with these hormonal type medications from whether they're parathyroid or whatever they are derived from. So I think that was a really good a point. That doesn't mean we shouldn't still get out there and exercise and do all that, but it can't expect it to cure. You know, you kind of put your head in the sand and say, oh, I'm just going to exercise and take calcium. I do that. So it's hard.
Thank you for sharing that. I really appreciate it. Thank you.
Yeah, I just wanted to say, I think I'm grateful that my first thought when I got diagnosed was I have to attack this on all fronts. And when I started, you know, reading these debates about, do you go down the medicine route versus the exercise route? I just immediately thought, why would you need to choose? I mean, you know, like, why are people beating themselves up to decide this way or that way? So I guess in retrospect, I guess I'm grateful that the doctor said, you have bad numbers, you must go on something. So I didn't know about any of this. And I just sort of thought, oh my goodness, I need to do something today. And then it's just been a journey from there. So we have each other, we have great research that we bring to the table to each other. And we're all sort of united in trying to support each other and help ourselves. So how lucky are we, right?
Can I just mention something about exercise? I agree that it can only do so much, but of course, one of the reasons you want to do a lot of exercises is so you don't fall, you know, so you have your muscles supporting you upright. And the other thing is the problem with anterior fractures of your spine, you know, that can happen without you even knowing it, especially when you have osteoporosis. So building up the muscles in your back to keep you upright and not hunched over. And of course, avoiding, like somebody mentioned, certain poses or certain ways of lifting or not lifting, you know, they're important, very important. I wanted to mention one more thing, because early on somebody mentioned about trabecular scores, and the Brigham and Women's osteo or whatever endocrine unit does have the machine that can give you that score. But I was told by Dr. Lou there that it's not going to be helpful if you've already been diagnosed with osteoporosis. It's only, you disagree, Diane?
Just really briefly, I pushed for it at my last visit just 2 months ago. I had to pay $131 extra, but I got one right at that very same endocrinology department. So
even though you have full-fledged, you have quite a lot of osteoporosis.
Did it help you to learn that, your tubercular?
Yeah. Yeah, I can't say right now without looking at my notes why, but I asked for a P1NP about the bone turnover and a trabecular score. I can't at the moment remember, but it all seemed to be indicating that that I'm really building bone right now. So it just gave me the confidence to know that I'm on the right path, which I've had none all the way through. So it was worth $131. So just so you know, at the same practice.
Well, I'm meeting with Dr. Lou tomorrow, actually, so I'll push it. I sort of got the impression it wasn't going to tell me anything any more than I already knew, but I haven't been on any meds, so maybe it's a different ballgame if you have been.
Doesn't it speak to your bone quality, the trabecular bone score?
Yeah.
So Diane, what did they read on your results for that?
I'd have to go back and look at it. Somebody correct me if I'm wrong, but the P1NP shows how how you're building bone, is that correct? The P1NP was off the charts. I think my number was 166 and the range is like 30 to 80 in terms of building bone. So mine was really off the charts. He said that was great. I'm honestly not remembering the trabecular bone score at the moment. I have to go back and look at it. So I'm sorry, I can't give you an answer, but I will look.
Can I jump in for a quick second? Sorry, my camera's been off because my internet's very unstable. I just wanted to follow up on Leslie a little bit. I do preach exercise quite a bit, so I'm gonna preface that. But I just wanted, Marissa, you just sounded a little kind of like, I don't want to project anything, but why do exercise if it's not going to help your bone density? But I just want to say a reminder that all of this is to prevent a fracture, really. I mean, then why do we care about osteoporosis? People could have osteoporosis and not even know it. We want to prevent a fracture. And so exercise and preventing a fracture is so vital to this. I mean, often balance is even more important than, and strength of the muscles. It's more important than the actual bone density. And so I just wanted to throw that out there just so
I'm
people don't
glad you
get frustrated
did.
about exercise.
No, thank you. And I wanted to add I do exercise. I do like a half hour of weight training twice, not cardio, weight training that I started when I got diagnosed. Just 2 times a week, I go and I lift weights. Do I want to go? No, but I do it. You know what I mean? And I've been very consistent on it. But I was hoping that I could turn myself around just doing exercising and eating well. But I'm saying those things I will not stop them. And you have to do that, but you also have to take something. I mean, that's what I'm hearing. Yeah. So.
Yeah, and then the research on exercise is difficult because it depends on the location of the bone loss. It depends on age. It depends on when you went through menopause. And so if you're postmenopausal with a lower score, it's a little bit slightly easier to get your bone density up with just exercise, as long as your calcium and vitamin D are normalized. And you don't have like you're on a thyroid medication or something like that. But the younger you are and the less loss of bone, the harder it is to build bone with exercise. So I'm assuming, yeah, it sounds like you're young, you're fit, and your score is just in your spine, which this bone density in the spine tends to be lost a little quicker. That we were talking about that trabecular bone. So yes, you are in a category that makes it a little harder to build bone, actually increase your bone density with exercise, assuming everything else is normal. But as you said, like now that your muscles are stronger, you are going to lift something with the bones are used to the forces of lifting more now than you were before you started lifting. So even though it didn't affect your bone density, it has absolutely affected your chances of fracturing, that you are less likely to fracture because you are stronger, not just because of your bone density, right? Because of your alignment, because of the strength of the muscles and how they're pulling on the bones, and that those bones have reacted to those forces. So anyways, I just, I'm sorry because I'm such a preacher of exercise. I'm also a preacher of the medications. They're fabulous, but I just didn't want anyone to get discouraged and like stop their exercise because of that. So sorry, Shelley, I hope I didn't interrupt.
No, I'm really glad you said that. No, Justine, I'm so glad you piped in with that, because I was also thinking about that in terms of nutrition and diet and those things, that just as much as exercise, you know, of course we don't want to stop doing the things that are, you know, it doesn't mean, in my way of thinking, it doesn't mean it will rid yourself of osteoporosis, but what would be the result of not doing those things and then seeing the result later? So you're just helping yourself even more, maybe just to keep it where it is.
Mhm.
And isn't there a benefit to that as well? So, you know, yeah, I'm glad you stepped in, Justine, because I agreed with that. And I think Marissa and other people who were talking about that do too. It's just, I think it's that frustration that I heard coming out about, just how frustrating it is to have to make that decision. And I can relate to that
Yeah,
too.
and I see a lot of patients with osteoporosis and the amount of frustration over like going on Prolia and then saying like, well, we don't know what to put you on next. And so that is so real and yeah,
Yes,
yeah,
it's
so real,
frustrating.
so common. It's very frustrating. What an amazing group you've brought together, Shelley, to allow people to express that frustration. It's just incredible. So thank you.
Justine, are you a physical therapist?
Yes, I'm a physical therapist.
Justine, could you plug your group a little bit?
We have a support group too, osteoporosis support group. We focus on exercise. We only have it 4 times a year. And elementscenter.com. I'll put it in the chat box, but we have one every season. And I'll put it in the chat box here.
Oh, that'd be
Sorry,
great.
my internet's not doing very well
Justine,
tonight, but yeah. So
Justine and I shared
definitely have a bias.
Justine and I shared that interview that we did from the VHOF because Lisa chose both of us to represent the support group part of the Giving Day of Giving. And I was just so taken. I'm like, I want to be in your support group, Justine. And then you've already hopped on ours. So thank you for that. That's really great. But I thought, you know, we meet on different nights and you meet 4 times a year. So I'd love to give a plug to your support group as well. Any other questions for our fabulous people that are giving of their story, their journey, their
Shelley,
time?
can I ask a question of Trina?
Definitely.
Yeah, Trina, you mentioned about your teeth. You said you had bad teeth. What do you consider bad teeth?
Well, I have lots of cracks, and the cracks, if they get bad enough, you know, sometimes a part of the tooth will split off. I've got, and then you need a crown, and sometimes they go down into the root, and so I have 2 root canals. And then the thing that's been the most troublesome has been this area at the top of the tooth and at the very top of the root. And I was told by my dentist a long time ago that I should have this procedure done, but it sounded horrendous. And so I just ignored the advice. And then I had to have that tooth removed. So I have an implant too. And it still seems that area is just not completely happy. And so if you do have, you know, a history of teeth issues, I mean, I try to take pretty good care of my teeth, and I don't, you know, one wonders why your osteoporosis or T scores are so bad when you're 50. You know, what did you not get calcium, or is that related to the teeth or whatever? But if you do have teeth issues, I think that is contraindicated with bisphosphonates, but I didn't really have a choice. So
Yeah, I understood from the literature that, like, if you had any dental procedures that you needed to do them before bisphosphonates. But I mean, I've had tons of work on my, you know, I have an implant, I have crowns, you know, lots of fillings, and I just assume that once, like, it's all taken care of now. So what you're saying is, if you have to have more dental work and you're on a bisphosphonate and you've had lots of work done, that might be a risk. Is that what you're saying?
you might have problems with healing
Right.
if you have to have a tooth taken out. So, yeah.
Okay, all right.
I mean,
Thanks.
I don't think I don't know. I've heard various things. I think there was somebody in this group who was a dentist who mentioned that she sees it with everyone on reclassed if they have to have a tooth extracted. If you look at the statistics, that it's a very few people, especially I think those who are on reclass for cancer have more of necrosis issues, but I don't know. It's what you're told or what information you can get is seems very confusing about it all. But dentists do not like to hear that you are on reclass if you have any tooth issues. And that's been my experience very recently. And I've heard that they try to pass you on because they don't want to deal with it if you need to have a procedure done, an invasive procedure done. So I don't know if that's true or not.
Thanks.
We should have, I can't remember who that was, Trina, but I do remember we had a dentist speak about that as well.
Yeah.
It was one of our members.
Yeah.
I have a question.
Sure.
Is it possible that at some point in time, without taking medication, that your bone loss will stop? That it's possible that I don't know, that it reaches a certain point and it remains steady, that you will no longer lose more bone? Or is it or is everybody that doesn't take medication, we're all going to just get worse over time? Or don't we know that?
Well, we're hoping for the best, and I don't know that we can completely stop it. Is that what the question is, Sharon? This is
Well,
Sharon.
if you didn't even start it, like I'm not taking any drugs, how bad does my bone density test have to be before a doctor is going to say, yeah, you need to be on a medication now? And when do you decide? Is it the number, or is it the advice of the doctor?
I think they vary. I mean, in my own experience, I should let the people in the group explain this, but in my own experience, I've been to 2 different endocrinologists, and they both thought that I needed to go on medication right away. And I am definitely in osteoporosis in all 3 areas of my numbers. So that's probably why that I got that recommendation. I don't know if anyone else wants to address that. Would anyone else like to say something about that?
I'm happy to say something. According to the NOF, the first 5 years post-menopause is that big drop. So you lose up to 5%. After that, it tends to go down closer to 1%. So yeah, it's a gradual drop, hopefully less because of the big hormone changes slow down. But there's so many factors involved in that, like race, and someone mentioned already thin wrists, and family history and all of these things. So like you guys have all said, the doctors that look at you as a whole person and take into every factor what medications you are, what your vitamin D levels, those are the ones you start trusting, right? Because they're looking at you as a whole being. And so the rate of loss goes down significantly, but then they're going to look at all the factors for fracturing. That's why that FRAC score is in there too, and not just bone density, but that's just, yeah, Diane knows a lot.
Well, no, gonna say to your point about that losing bone, dramatically in the first 5 years. When I first got diagnosed, I know this is a little off topic, but I thought, if this is true for most women, then why don't they insist, like with mammograms, to have a baseline before you go through menopause for all women? Do you know how cheap DEXA scan is? It's like, if I had known this years earlier, even though I begged for one, my doctor said, you don't have any of the risk factors. And I said, before I knew anything, I said, look at my wrists, look how thin my wrists are. And she said, but you never smoked, you did blah, blah, blah. You haven't been on any, meds, all that. And then finally I prevailed. I was told how cheap it was for a DEXA scan. And then sure enough, I have full-blown osteoporosis. If that as a policy, think about how much money the insurance companies would save, and maybe the drug companies would lose, who knows? But if a woman, and men too, if they had a baseline bone density scan before women menopause, we would have a warning sign, and it would have saved a lot of pain and a lot of expense and anxiety down the road. That should be the protocol in my view. Off my soapbox.
But I just want to add in from personal experience that, and I'm older than many folks here, but from the 7 years when I didn't have a bone scan, my total hip score doubled. I had a huge jump, and my femoral neck went up 30% in those 7 years. So, and that I was 64 to 70 basically. So it didn't slow up by any means.
So you mean that you decreased density?
I decreased, I'm sorry. Yeah, I mean, it got worse. It went up, getting worse.
Number went up. Yeah.
Yeah.
Yeah. I think if it's over 1%, that's what we've been told, right? Generally, if you're losing more than 1% a year, then that's not good news.
Yeah, like I mentioned earlier, over 10 years, I went from minus 2.3 in my spine and minus 2.5 in my total hip to minus 3.8 in my spine and minus 3.1 in my hip. So that's without medication, exercise, good eating, no smoking, no drinking, no sugar, no blah, blah, blah. So it didn't improve.
I was listening to I guess it was Lonnie Simpson on that Natural link today, which I'm going to reshare that in Google Groups that Steffi had shared with us. And Lonnie was saying that every standard deviation is 12%. So I don't know, but so I guess I would be a little bit, I'm always very concerned, but they say that when you do a DEXA scan, the accuracy is questionable sometimes based on, she also said, how they do the bone test itself, where they're measuring the actual, femoral neck, where exactly they're doing it on it. Are they actually using the same template as they did a year ago when you had it done? And many people that read them don't read them accurately. So, not to get, I think my other thought is that not to get so bent out of shape by the DEXA scan, because as Justine just said, the real issue is, are you fracturing? And it's really, that's what osteoporosis is really about, preventing bone fracturing. And we're doing it through many ways: medication, diet, reduce stress, etc. That's the world according to Shelley. I just had to pipe in with that thought. Anyway, any last question? Because of course Lisa, did you have one? Yeah.
Oh, no, I just wanted to weigh in since you brought up Lanny Simpson.
Oh, yeah.
I don't know if those talks are free for 24 hours only, but there was a physical therapist who spoke today. And Amy M., I don't know if you can help me out here. I'm blanking on her name, but she's day 2. She's a physical therapist, PhD. I think they all have to be PhDs now to enter the field.
Yeah.
And I posted this in Google Groups. I don't know how many of you are looking at Google Groups. Every minute of what she said to me was so important. The research isn't there on building bone through exercise. We know it can help us maintain balance. and it's good in general, but she posted some excellent sources or mentioned them. I don't know. Marge Bissinger was supposed to follow up with the posts and answering questions, but it may only be good until, or free until 10 o'clock tomorrow. And she cited sources of information on ongoing research and other really good sources of information. I just, and there were other things like Sarah Meeks was on today. Some of you know, someone mentioned the term realignment. Wow, is that important? And our physical therapist from DC, I'm sorry, I'm blanking on your name.
Justine.
Yeah, Justine, you mentioned alignment. Wow, that's really, I have scoliosis, so I know firsthand how important that is. But I'm just getting back to Sarah Meeks, who's going to be our speaker, I think, Shelley.
Yes.
She mentioned something. I have degenerative, meniscus tears. And she said, you don't want your weight on your toes. She described an exercise that I've been doing. I met with her privately, virtually, and I've been doing it since we spoke. And I recommend her talk too. She's really salt of the earth, and she's been a physical therapist since, I think she said 1962. I know she's in her 80s. So if you do the numbers, I guess it's possible. I love that one, and I don't want you to have to pay. And Lanny Simpson brought up some really thought-provoking subjects for me, which I will follow up on with my bone doc. So that's all I'll say for now.
I have to say, I totally agree with you, though. So many interesting points in those. That's why I wanted to listen to all of them, and just time wouldn't allow me to. It's just so many speakers. But you can listen to it for free right now and till tomorrow at 10 o'clock. And I'll forward that. Any last question or comment anybody likes to make tonight? Kathy.
Hi, I just want to quickly introduce myself. I came upon this group in a kind of a funny way, but I'll keep it short. I was diagnosed with osteopenia back when I was 32, which was back in 99. And I have crossed the threshold of osteoporosis back when I was like 52, I think. So that's been 3 years. Early in the days, they put me on Fosamax. Didn't work well with me. I got muscle cramps. So I've just kind of winged it since. I do a lot of working out, and it's not really benefiting me all that much, but I do it anyways to keep my balance good. And I'm glad to be part of this group to learn more about the meds.
Well, glad to have you, Kathy. Kathy and I have a friendship, so that's how we came into knowing. So it's great to have you here. All right, well, next meeting, and I want to thank, we didn't even thank these wonderful people. Can we do some applause here? Unmute so you can applaud them. Please unmute. Ooh. We can do better than that. Come on, unmute.
Thank you.
Thank you so much.
This was so good. It was really, really helpful.
Yeah.
So in February 1st, we actually have Sarah Meeks speaking, who is a
great,
wonderful expert in those exercise. And of course, I've just asked Justine if she'll do another talk in a little bit. So, but we have, after Sarah, we then have Payal from, who is a researcher, endocrinologist in March. And then I believe after that we have Dr. Joy Tsai from Mass General. And so we have a nice lineup for the spring, and I want to thank everybody, and I'm really excited about Google Groups, and I want to say go in and check it out. I'll send you the link to Google Groups tonight, and was there anything else and the link to Google Groups and the link to the natural
Shelley, just a quick question. Can we get access to all these wonderful talks that you all are mentioning? I see the Google Groups notice, but I didn't see any links to their talks.
Right, right. The talks that you're referring to, that some of you are referring to.
Well, Steffi had told us about it, and you have to go in and register your name and your email, and then you will be entered into a queue to see the day of speakers. And you can go to past days. If you study the little screen, you'll find the past days on there. And but I believe tomorrow it ends. And so like 10 o'clock tomorrow night. I did go in, just parenthetically, I did pay my $69 and so that I would have access, because there was no way I could listen to all of them and I kind of wanted to. They're quite good. I don't know if I can share that. That probably isn't kosher anyway, but but anyway, if you can't, go to look at the subjects. They have the subject next to each speaker of what they're going to talk about, and definitely pick out some of the ones you most want to see.
But where do you go into?
Yeah, it's unclear.
It's a link. I believe I'm going to send it to you in an email after this is over.
Right, right.
But I don't know it off the top of my head. Does anybody?
Yeah.
Thanks, everybody.
Okay. All right. Well, thank you. And have a great night, everybody.
Thank you.
It was wonderful.
Thank you.
Thank you.
Thanks,
Bye,
Shelley, for
everybody.
doing this.
Bye-bye.
Thank you, Shelley.
Oh, my pleasure. You guys are
Okay,
great.
Good night. Thank you.
Great.